Good morning, class. This is the part 2 of the respiratory system. Okay, so this is module 19. Okay, ang gas exchange natin, or respiratory part 2 natin. Okay, so we will talk about the gas exchange. Okay, so di ba sa alveoli, ang alveoli muna siya ang site of gas exchange. Okay, so in here, so muna siya, ang alveoli muna siyang membrane. So, O2 and carbon dioxide or oxygen and carbon dioxide are constantly being supplied and removed through breathing, di ba? In and out ang aton nga O2 and carbon dioxide. So, in here, so kung mo ni siya ang parts ang parts ang aton nga this is the part of our alveolus or ang alveoli naton. Sorry. Okay? So, oxygen can diffuse across the cell membrane of the cell that lines the alveolus. Okay? So, from there, it can obviously diffuse to outside of the cell. So, pwede siya kagwa. So, pwede siya di kasulod ang O2, pwede man siya di kagwa. Okay? So, the same thing applies for the lining of the blood capillary until eventually it diffuses into the RBC where it can bind with hemoglobin to form oxyhemoglobin. Okay, so once ang O2 magbind na diri sa aton nga RBC, makadto siya. So, magiging, inatawag siya nga oxyhemoglobin. Okay, so carbon dioxide can also diffuse across the cell membranes. So, pwede man kakadudi ang carbon dioxide. Okay, so carbon dioxide can also diffuse across the cell membranes and reach the alveolus, then exit the body. So, oxygen is being constantly applied through breathing, but it also being taken away from this area because of the blood flow. So, it means it's constantly maintaining a concentration gradient, which is what allows this transfer of gas exchange to continue. Okay? So, we have here the rhythmic breathing. Okay, so 12 to 20 breaths per minute or beats per minute, normal rate of breathing in adults. So 20 to 40 breaths per minute, ang BPM is breaths per minute, or kung sa pulse rate, or ang kung pulse is beats per minute, 20 to 40 breaths per minute naman, normal rate of breathing in children. So medyo taas kung children. So ang adult, medyo muna na, nubo na siya. So, respiratory areas are controlled within the medullary respiratory centers consisting of two. So, amo na siya ang two dorsal respiratory groups kag ang two ventral respiratory groups. Kag ang pontine respiratory group. Okay, so we have three. So, ang two dorsal respiratory groups stimulate the contractions of the diaphragm. So, muna siyang ga-stimulate sang contractions sang aton diaphragm, ang two dorsal respiratory group. While ang ventral respiratory group stimulate the intercostal and abdominal muscles. So, we have here the pre-Botzinger's complex known to establish the basic rhythm of breathing. Okay? Tandaan ha, basic rhythm of breathing. Siya ang ga-establish. So, ang pontine respiratory group naman, collection of neurons in pons and play a role in switching between inspiration and expiration. So we have here the generation of rhythmic breathing. So stimulus activates medullary respiratory center and inputs reach the threshold levels. Then somatic nervous system neurons stimulate the respiratory muscles via action potentials. And then inspiration starts. So more neurons activated. So lasting approximately for 2 seconds. And then it inputs from pontine respiratory neurons, stretch receptors, and other sources exceed threshold. Then it stimulates respiratory muscles to be inhibited and be relaxed. And then expiration lasting for approximately 3 seconds. Okay, so nervous control of breathing. Breathing can be voluntary controlled. However, as soon as conscious control of respiration is lost automatic control resumes and the person starts to breathe again. And we have here the Hinger-Brewer reflex. So, ang Hinger-Brewer reflex supports rhythmic respiratory movements by limiting the extent of inspiration. And then we have the touch, thermal, and pain receptors in skin stimulate the respiratory center. So we have here the chemical control of breathing. The level of carbon dioxide in blood is the major driving force regulating breathing. So may kita hypercapnia. Ang hypercapnia, increase in carbon dioxide level. And hypoxia, low level of O2 in tissues. So kisa kung wala na kita O2 or wala na may ka-supply nga O2 sa aton, ginatawag siya nga hypoxia. So sometimes, example, nakuga siya na pag nakuga siya or strangulated or basta naging kuga. So 'di ba? Wala auto makasupply sa aton nga brain, 'di ba? So one of the example is hypoxia of the brain. So it's because wala na oxygen nga gakado sa brain ta. Low O2 in tissues. So, pwede magka-hypoxia in different areas. Okay? So, delikado kung hypoxia sa brain, it's because it may cause brain dead, dason, or mapatay ka na. Okay? So, effect of exercise on breathing. So, initial increase can be as much as 50% of total increase that will occur abruptly. So, after onset of exercise, breathing increases immediately, continues gradually, and levels off within 4 to 6 minutes. So, anaerobic threshold, highest level of exercise, can be performed without causing a significant change in blood pH. Then we have respiratory adaptations to exercise. So, vital capacity increases slightly and residual volume decreases slightly. Then, ang tidal volume remains the same but increases during maximal exercise. So, mga vital capacity and tidal, di ba na lesson naman nato na siya? Then, minute volume for athlete is unchanged or slightly reduced at rest. But a maximal exercise, it is greatly increased. So, we have diseases and disorders ang aton nga respiratory system. So, this is number one, ang pinaka-common, mga sinusitis. Ang sinusitis, so inflammation of mucous membrane of sinus, one or more paranasal sinuses. So, basta may itis, di ba? Inflammation. So, may ara kita kakatabo nga swelling, kag inflammation sa tissue lining sa aton nga sinuses. Okay? So, sometimes, di ba, ang symptoms ini is runny nose, facial pain, or may pressure, di ba, may sakit sa may nose area, then headache, sore throat, cough, bad breath, and fever. Okay? So, sometimes, hindi na ikaw kasimhot, tungod, hindi ka na nare-reduce na ang sense of smell mo. It's because, inflame ang imo nga lining sang sinuses naton. So, may sinusitis kita na. So, sometimes it is also caused by a viral infection such as ang cold and flu. Okay, or mga allergens na siya. Then, ang laryngitis naman. So, inflammation of mucous epithelium of vocal folds. Ang aton inflammation of the larynx or ang aton nga voice box naton. So, common ni siya kung always tungod man sa allergen sometimes or mga injury or irritants or mga dry cough or tungod man sa mga viral infections such as flu or colds or straining of your voice. So commonly when you say straining of your voice, when you talk too much, so sino ni sila. So mga ga-speak always, ang work nila gahambal always. So pero yung sa mga call center agents, always they always diagnose sang acute laryngitis always. Amo na ila nga diagnosis always sa mga gakapaos na bala. So, symptoms yun is hoarseness or loss of voice. So, dry cough, sore throat, sometimes may man mild fever. So, pain in the front of the neck. So, difficulty of swallowing. Kag may swollen lymph nodes in the neck. Muna ang mga symptoms ng laryngitis. So, about pertussis and whooping cough. So, di ba doon nag-ano ang pertussis last year ata? So, this is the bacterial infection of tracheobronchial tree caused by Bordetella pertussis. So, tandaan ha, Bordetella pertussis. Muna siya caused by Bordetella pertussis ang pertussis. So, highly contagious and can be prevented by vaccination. So, do pareho lang sila or the same lang ni sila. Medyo pagka the same, pero iba ang pertussis sa dugi na ubo lang ba lang normal. Kaya diba do respiratory infection man ni sa Japon. But, ginatawag siya gani a whooping cough. It's because may different ni siya nga tunog. So, whooping sound. After coughing, someone with pertussis may need to take deep breaths that result in a whooping sound. Okay? So, hindi ko lang maano kung ano ang tunog. Pero you can search that kung anong tunog sa whooping cough sa pertussis. Okay? So, delikado man yun siya sa infants. It's because, pwede sila magka-apnea. Okay? So, kung ang apnea naman sa infants, it's like the stop ang breathing or it's pause of a child's breathing pattern. So gauntat-untat. Okay? So hyaline membrane disease known as infant respiratory distress syndrome or ang IRDS caused by too little surfactant. Okay? So when you say too little surfactant, diba mo na siya ang chemical compound na gina-reduce ang surface tension between gina-reduce niya ang surface tension nga which prevents the alveoli from collapsing after inhalation. So, kung wala kung gumay ang surfactant sa infants, then how can they breathe, diba? Hindi sila kaginhawa mayad. So, may tendency nga mag-collapse ang ilang lungs or ang alveoli kung kulang surfactant. So, that's why hambal ko sa first topic naton, di ba? Kinatagaan sa surfactant ang mga premature babies or ang mga babies nga or infants nga wala pa nag-develop masyado ila lungs. Okay? So, pneumothorax, introduction of air into the pleural cavity, the space between the parietal and visceral pleura that normally contains only pleural fluid. So may mga pwede ni sila sa tungod sa trauma or injury, nagka-pneumothorax, di ba nagka-air na sa aton nga pleural cavity, so which is hindi dapat. So manang tawag pneumothorax. So, pwede man sa mga tungod sa mga lung diseases, sila. So, symptoms of pneumothorax, so includes like sudden or sharp chest pain. So, especially when they breathe or they cough, sila budlayan sila or may chest pain silang nababatyagan. Or may kita SOB or shortness of breath. Then, chest tightness and bluish color of the skin, nails, and lips. Then, gadasig aton nga heart rate or rapid heart rate. So, sila. Or feeling lightheadedness or feeling mo dumalipong ka. Maina siya. So, mga possible signs ng pneumothorax. Okay? So, next we have the asthma. Of course, ang asthma, balaan nyo naman ni Guro. So, characterized by normally increased constriction of trachea and bronchi in response to virus stimuli, which decrease ventilation efficiently. So, may mga asthma, so they tend to, may mga allergies ni sa tungod man sa mga allergens. So, sometimes causes niya is inflammation, caused by an inflammation and muscle tightening around the airways. Dubudlayan sila ang ginhawa. So, damo triggers, 'di ba? Kung may asthma ka, so pwede mag-contribute ang air pollution, mga dust. So, kisa kung too much exercise, muna, 'di ba? Mga ang smoking, ang smell or ang smoke, 'di ba? Or mga strong chemicals pwede ma-trigger sa tao na may asthma. Okay. So, common ni siya sa both children and adults. Okay. Okay. So, effects of aging on the respiratory system, vital capacity, and maximum minute ventilation decrease due to weakening of respiratory muscles and stiffening of the thoracic cage. And then, residual volume and dead space increase because the diameter of respiratory passageway increases. Then, an increase in resting tidal volume compensates for increased dead space, loss of alveolar walls or surface area, and thickening of alveolar walls. So, the ability to remove the mucus from respiratory passageway decreases. So, hindi sila masyado kapagwa sa mucus, 'di ba? So, sometimes, 'di ba, ibang ginatubuhan na lang ang mga old people kag ginasaksyon. Mo ina. So, that's all for our module 18 and 19. Ang 17 na lang guro i-next ko. Okay? Thank you.